As the COVID-19 epidemic approaches its third year, several countries, including the United States, are noticing an increase in the number of people having concerns with their mental health, particularly among communities that are vulnerable. In this video, we are going to talk about mental health crisis in USA. Explained. So, before starting the video, please like this video, do subscribe and turn on the notification to our channel for future updates. Their lives have been turned upside down by other effects of the pandemic, such as the closure of schools, increased economic insecurity, and increased family distress, including the deaths of parents and other family members. Although children and young adults have a lower risk of becoming severely ill or dying from the disease, their lives have been turned upside down by other effects of the pandemic. These strains have further exacerbated a crisis that was already present in terms of the mental health of young people in the United States even before the pandemic began. According to the results of a recent poll, an overwhelming majority of people living in the United States believe that their nation is currently undergoing a crisis regarding mental health. Adults in the United States are unanimous in their belief that the country is currently facing a crisis in terms of mental health. When asked to rank the severity of 6 other particular mental health concerns, Americans placed the opioid epidemic near the top of the list, with more than 2/3 of adults recognizing it as a crisis rather than merely a problem. More than half of respondents classified serious mental illness in adults as a crisis, in addition to the prevalence of mental health problems in children and adolescents. During the course of the summer, a nationally representative sample of around 2,000 persons participated in the survey. This took place approximately 2.5 years into the COVID-19 pandemic and in the midst of ongoing public health risks such as racism and gun violence. The general concern is well-founded, with its roots in both individual experience and general tendencies across the country. Adults have an alarmingly high rate of mental illness. 9.86% of adult people are dealing with some form of mental illness. That's roughly equivalent to 50 million people in the United States. 4.91% are having a severe mental illness. Between 16.37% in New Jersey to 26.86% in Utah, the frequency of adult mental illness varies greatly from state to state. Having a mental, behavioral, or emotional disease that can be diagnosed, as opposed to a developmental disorder or a substance use disorder, is what is meant by the term any mental illness. People with mild mental illness, moderate mental illness, and severe mental illness are all included in the category of people who have any mental illness. Well, do you like what you are seeing so far? Don't forget to like and subscribe. Keep watching because you don't want to miss what we have at the end. Adult patients suffering from a substance use disorder. In the previous year, people in the United States reported a substance use disorder prevalence rate of 7.74%. A condition related to the use of illegal drugs was reported by 2.97% of people in the United States in the most recent year. In the previous year, 5.71% of individuals in the United States reported having an alcohol use disorder. From 5.98% in Florida to 12.3% in the District of Columbia, the prevalence of adults suffering from substance use disorder varies greatly from state to state. Adults who are having serious thoughts of taking their own lives. 4.58% of all adults will admit to having severe suicidal thoughts at some point. The number of adults who have serious suicidal thoughts is projected to be over 11.4 million, which is an increase of 664,000 individuals over the data set from the previous year. Every year, there is an increase in the percentage of adults in the United States who report having suicidal thoughts. There is a wide variety of suicidal ideation among adults throughout the states, with New Jersey having the lowest frequency at 3.79% and Utah having the highest prevalence at 6.19%. The majority of adults who have only fair or poor mental health reported that they do not feel comfortable talking to loved ones about it, with some citing a desire to maintain privacy and others citing a desire to avoid the shame and stigma associated with mental health issues. This is despite an increased willingness among the general public as well as commonly shared stressors. However, the vast majority of people surveyed, more than 4 out of 5, believe that individuals and families should play an equally important role in addressing mental health problems in the United States. This proportion of people believes that healthcare providers should have the same opinion. So, that's it for today's video. What do you think of our video? Hit us up in the comments and let's chat. Don't forget to like, subscribe, and turn on the notifications for our channel so you never miss what's coming next from us. Thanks for watching.